When the first case of HIV in Kenya was detected in 1984, the country went into a panic. The resulting stigma forced many with the virus into hiding, as images of emaciated patients in the terminal stages of AIDS dominated mainstream media. But 39 years later, Kenya has a different story to tell.
Time nilikuja kujijua I'm HIV positive, I was in class 7. That is when I had defaulted on medication. And the reason for me defaulting on medication, it was because nilikuwa napewa dawa zikiwa za kifua. Because when you are a kid, no one will tell you are HIV positive.
Anthony Chege is one among a crop of young HIV champions spreading awareness about the condition on TikTok. He chronicles his daily life on the platform, giving HIV a friendly, familiar face.
Some of my peers, AYPs, adolescent and youth living with HIV, they are struggling just like me, how I was struggling. Nikaona, why can't I come out in public? I try to help them how to handle this status.
As a child, the 26-year-old loctician had a hard time accepting his status, but today, he's a champion of the cause.
Maybe muna have maybe games na vijana, but unapata most of the time watu wana kutenga hivyo. Kama ni kukula food, hakuna mwenye anaweza kula nawe kwa sahani moja. So hizo manini zilikuwa tu zinani infect mentally na psychologically.
Chege chose the platform because of its popularity. According to the Reuters Institute 2023 Digital News Survey, Kenya leads the world in usage of TikTok.
4 hours azishangi kama tu sija scroll video moja ya TikTok. And seem like to everyone out here. Unapata tu hata tu akiwa kwa job amerelax, anaamua tu ku scroll TikTok hata kama ni video moja tu. Na kuna mtu atapatana na mtu hapo akikunywa ya Alvis, amwe hebu niangalie.
This year, Kenya reduced HIV transmissions by half in 13 counties through a combination of interventions that included viral suppression among HIV-positive people. Despite this, 3,244 new infections occurred among adolescents aged 10 to 19 years, with young people aged 15 to 24 accounting for 41% of all new HIV infections in 2022. The 2022 Kenya Demographic and Health Survey attributes this to poor awareness, with only 47.3% of young women having knowledge about HIV prevention compared to 48.7% of young men. To spread awareness about viral suppression, Chege uses the slogan "You equals you," a campaign started by Prevention Access Campaign.
Hapa kwa You equals to you inakuja, what if we as the positive people, we take our medication as prescribed and we be undetectable? When all of us who are positive we are undetectable, hata kukuwe na ushalati na kaje, yes, on the part of HIV, tutakuwa tume-eliminate. Kwa undetectable equals to untransmittable. Since we can't transmit the virus when we are undetectable. A copy of virus inastahili kuwa below 200 copies for you to be undetectable. It doesn't mean that you are healed from HIV. It just means that the levels of the viral load are minimal.
For HIV-positive persons looking to have children with HIV-negative partners, viral suppression is critical.
If you're ready for pregnancy, it means the sex is going to be unprotected. So it really comes in play when the HIV-infected partner is adherent to their ARVs, virally suppressed, and within that window they can try and have a baby because the risk of transmission of HIV to the negative partner is significantly reduced.
With the government announcing plans to mainstream digital health services, experts say social media could play an important role in reducing transmission rates.
With adolescents and young people, the phase they're in life, still struggling with disclosure, struggling with peer pressure to fit in. So that is why it's really important to offer these other interventions that are not just mainstream testing and treatment.
It's just important to realize that all these platforms have very different audiences, and that it's great to tailor-make all the information that we have on the different interventions and the outreach that we do through social media. So whatever medium that they choose, be it calls, SMS, the WhatsApp, be it the social media or the website, whatever medium they choose, they can get the information that they need at their fingertips.
But HIV advocates also want the government to address systemic challenges that stand in the way of reducing the threat of HIV.
Even worse is when we have commodity stockouts in terms of testing, and now you see we are trying to eliminate mother-to-child transmission. So how do we ensure that our infants are tested on time to just determine, are they HIV exposed, are they HIV infected? So that is something that the national government really needs to prioritize in terms of just ensuring we do have that commodity security.
In keeping with the theme for this year's World AIDS Day, which is Let Communities Lead, stakeholders are advocating for community-led initiatives to combat the triple threat of HIV infections, sexual and gender-based violence, and teenage pregnancy.
When you look at something like triple threat, the community leaders do have a significant role in identifying where the challenge is in terms of gender-based violence, just safeguarding the gender norms within the community, and ensuring that perpetrators actually followed through and justice is served, because that eventually reduces the number of GBV cases, and even early identification and reporting of these cases to provide timely intervention.
We want the community first. They have to lead in this fight against HIV. The stigma iko surrounded to HIV, because wakati wao wote wameweza kukua educated about HIV, everything will be, itakuwa smooth kabisa. Umejipata to a situation you are positive, also I mind what people are saying. Let your health come first.
Muriel Adhiambo, K24 TV, Nairobi.